Let's talk about the changes that occurred during the coronavirus pandemic in regards to telehealth insurance coverage and reimbursement. So what were the changes that you saw?
Well, I think COVID, it's sad to say, brought along some positive changes because without it, would not see these changes probably. Some of them are going to be permanent, some are going to be temporary. So I guess we'll start with temporary, start with the Medicare program. I'm sure most of your listeners are aware that prior to COVID-19, physical therapists, occupational therapists, and speech language pathologists were not recognized telehealth providers, meaning Medicare did not pay for telehealth. Now, the good news is a PT, an OT, and SLP could do a telehealth visit with the Medicare beneficiary and charge them cash since telehealth was statutory non-covered. Due to COVID, on a temporary basis now until the public health emergency is declared over, the Medicare program does cover outpatient PT, OT, and SLP services delivered via telehealth. And the payment for those services are exactly the same as if the patient came for an in-person visit. Unfortunately, once the public health emergency is declared over, without congressional action, telehealth would no longer be covered for outpatient PT, OT, and SLP services. So we have to wait. Obviously, we're working with Congress on all of this to, those bills introduced in both the House and the Senate to add PTs as permanent telehealth providers. As I'm sure your listeners know, Congress isn't getting along right now. They haven't gotten along in a while. So we'll have to see, what goes. But I do think, that's my opinion, I do think somewhere soon, I do believe Congress will add PTs as well as OTs, SLPs as eligible telehealth providers. The good news is, United Healthcare and Cigna, for the private practice therapists, definitely have added telehealth permanently. For those two insurance companies. We also know Blue Cross Blue Shield of Tennessee has added it. So TRICARE before COVID was already covering telehealth for outpatient therapy services. So I think if we can get Congress to add PT, OT, SLPs as permanent telehealth providers, I think that's going to help us with the other insurances, maybe that are still hanging out there, like the APTA, like the Humana, and maybe other Blue Crosses that are in your respective states.